Hey everyone, welcome back to the channel. If you're new here, I'm Desmond, and today we're talking about something really important for anyone with diabetes, diabetic ketoacidosis, or DKA. It's a serious condition that can happen when your body doesn't have enough insulin, but don't worry. We'll break it all down so it's easy to understand, and we'll learn how to spot it early and what to do about it. So, let's start with the basics. What exactly is DKA? Well, DKA is a life-threatening condition that can happen when your body doesn't have enough insulin to turn sugar or glucose into energy. When this happens, your body starts breaking down fat for fuel instead, which leads to the buildup of acids called ketones. This can cause your blood to become too acidic, and that's where the problems start. In other words, without insulin, your body starts running on fat, and ketones are the byproduct. If too many ketones build up, it can lead to metabolic acidosis, which messes with your body's balance and causes a lot of problems. So how does DKA happen? Well, there are a few steps that lead to it. Insulin deficiency. Your body either doesn't make enough insulin or your cells aren't using the insulin properly. High blood sugar. Without insulin, sugar builds up in the blood because it can't get into your cells to be used for energy. Fat breakdown. To try and get energy, your body starts breaking down fat, which creates ketones. Ketone buildup. As ketones build up, your blood becomes more acidic, which can lead to serious problems like dehydration, shock, and even coma. It's kind of like your body running out of fuel and trying to use backup fuel that creates a toxic waste byproduct, ketones. Now, how do you spot DKA? It's important to recognize the symptoms early so you can get help right away. Here's what you should look out for. Excessive thirst, because you're dehydrated from high blood sugar. Frequent urination. Your body tries to get rid of excess sugar through urine. Fruity smelling breath, a classic sign of ketones building up. Nausea and vomiting. Your stomach is reacting to the acidic blood. Fatigue. You're feeling weak because your body isn't using energy properly. Rapid breathing. Your body is trying to get rid of acid by breathing faster. Confusion. As the acid levels rise, your brain isn't functioning as clearly. So what can trigger DKA? Some of the most common causes include infection. An illness like the flu can make your body need more insulin, leading to DKA if it's not managed. Missed insulin doses. Skipping your insulin or not taking enough is a major cause. Severe illness or stress. Physical stress from other health conditions can also raise blood sugar levels. Undiagnosed type 1 diabetes. People who don't know they have type 1 diabetes might experience DKA as their first symptom. Basically, anything that increases your body's need for insulin can trigger DKA if you're not taking care of your blood sugar properly. Let's make this interactive. Have you ever experienced DKA or seen someone go through it? Share your experiences in the comments below. If you haven't, now you know the signs to watch for. So, what happens if someone develops DKA? The good news is, DKA can be treated if caught early. Here's how doctors usually handle it. Fluids. The first step is to give IV fluids to help rehydrate the body. Insulin. The next step is to give insulin to help lower the blood sugar and stop the breakdown of fat, which lowers ketone production. Electrolytes. Since DKA can mess with your electrolytes like potassium, doctors will replace these as well. Monitoring. The patient is monitored closely in a hospital setting to make sure their blood sugar and ketone levels are returning to normal. With proper treatment, most people make a full recovery from DKA, but the key is getting help as soon as possible. Prevention is always better than treatment, right? Here are some important tips to help prevent DKA. Check your blood sugar regularly, especially if you're sick or stressed. Take your insulin as prescribed even if you feel fine. Stay hydrated. Drink plenty of fluids, especially when you're sick or feeling dehydrated. Know the signs of infection or illness and treat them early to avoid triggering DKA. By staying on top of your blood sugar and insulin, you can prevent DKA from happening. To wrap it up, here are the key things to remember about DKA. DKA is a dangerous condition that can happen when there's not enough insulin in the body. It causes high blood sugar, dehydration, and a buildup of ketones, which makes the blood acidic. The symptoms include excessive thirst, fruity-smelling breath, nausea, and confusion. It's triggered by things like infection, missed insulin doses, or stress. Treatment includes rehydration, insulin therapy, and electrolyte balance. Thanks so much for watching. I hope this video helped you understand DKA and why it's so important to stay on top of your diabetes management. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon so you never miss a new video. And of course, feel free to drop any questions or comments below. Stay healthy, and I'll see you next time.